want to talk to you about lumbar spinal stenosis. So you probably don't know what that is, or it sounds like it's complicated. It's not. It really simply means the narrowing of the canal in the lumbar spine that is almost commensurate with aging. If you're in your 60s or 70s, it's about 30% of the population develops this narrowing, but the problem is that narrowing starts to choke, for lack of a better term, the nerves that come out and then go down the legs and buttocks, etc. So the reason I want to talk to you is that there's a big change that's happening in spine surgery, and where it typically was a problem that we really only had two options, maybe three, where we'd give you an epidural and hope for the best with steroid. And then if that didn't work, you try your three, you have a big surgery with a laminectomy and then ultimately a fusion. That has changed and is evolving even now. And we're really on the cusp of a massive revolution. That started about 7 to 10 years ago when we had a procedure introduced called MILD. That minimally invasive lumbar decompression was a small surgery done basically through a pencil. Going into the spine, and I'll show you what that looks like, and nibbling away at what's called the ligamentum flavum, which is one of those things that was encroaching in on the nerves, pinching and strangling the nerves. And we're able to, under live visualization with this machine here, the fluoroscope, actually debride and remove part of that ligament so it took the pressure off the nerves. So this is your spine, as you can imagine from the side. There's the front. This is the lumbar sacral junction, where pretty much all spinal stenosis occurs. That affects the low back and legs. So the newest approaches to treating stenosis is simply at the level where you're narrow, put in a little device that holds open that space just like you're in the sitting position as you stand and walk. MILD, conversely, that we talked about earlier, is the passing of the little pencil, and I do it while you're awake. There's no need for anesthesia with this. I like people awake for this. You just numb you up. We talk about golf or knitting or whatever you want to talk about while we're nibbling away. And so the idea is to keep you awake while we nibble and then remove enough so that we can see the flow of the contrast up the spine. And once that occurs, we know it's open and you're done with the procedure and you go home. It's that simple. There's no overnight stay in the hospital, nothing like that. That's MILD. And the same is honestly true when we do the spacers. So this is a huge change in the way we go about treating spine. If people can walk, their cardiovascular effects of it, just their whole body effects, are that they live longer and better lives. And so spinal stenosis is a massive problem in the US, especially in folks aged 60 and older. And now really we can treat it without the huge attendant risks of open spine surgery. So that's why I'm so excited.